Welcome, everyone, and thank you so much for joining us today. It's a very exciting webinar and very timely. It's Making Nutrition and Supplementation Fun and Effective for Kids. It's presented today by Dr. Sarah Zadek, and my name is Dr. Navneet Nibber. I'm a medical advisor with AOR. I'm going to be your host and moderator for today's presentation. Before we get started, I just want to go through a few housekeeping items. There is going to be a question and answer session right at the end here for us. And throughout the presentation, you can click on the little box on the right-hand side of your screen that says questions and ask throughout the presentation. We will get to it, so don't worry if it's not answered right away. And please note that the presentation itself is being recorded for future distribution. So the content of this webinar has not been evaluated by Health Canada or the FDA. It's meant to be educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note the opinions of the guests and the hosts are of our own and may not reflect those of Advanced Orthomolecular Research Inc. So now that that stuff is out of the way, let's meet today's presenter. Dr. Sarah Zadek is a wonderful presenter. If you've seen any of her past webinars, she's a board-certified naturopathic doctor practicing in Ontario, and she is an esteemed author who has contributed to multiple journals and magazines. Her clinical focus is on women's health, endocrinology, and fertility. So suffice to say, she knows what she's talking about. We are ready to begin. So without further ado, I'm going to pass it over to Dr. Zadek. Welcome and thank you so much for joining us.
Thank you, Neerat, and welcome everyone today on this, well, here in Ontario, it's a little bit gloomy after a nice long weekend. So hopefully we'll have some fun today talking about, how to incorporate nutrition and even supplements for your children and how to do it in a way that actually they're not going to fight us on is really what we're talking about today is incorporating new healthy lifestyles and tricks. From what I'm going to discuss today, some of it comes from the research where a couple of researchers have looked at different parenting forums and looking at, what are parents using as strategies nowadays? Which ones have been successful, which ones maybe aren't as successful, and which ones work better for different personalities of children. So we're going to dive into that as well. As Neerat introduced myself, I am a fertility-focused naturopath and a new mom as well. So my little girl just turned 10 months today. And I've also had the trial and errors of giving her certain supplements like probiotics and vitamin D. So that's going to come into play today as well. Okay, so our current challenges when it comes to using nutrition and supplements in children are that, first of all, there are different personalities to children, right? Some are a little bit more easier going when they're about to be given something, whether it's a food or a supplement, right? A lot of children have different taste preferences, right? As well as appetite levels. Some children will refuse to take any kind of supplement or medication, which can lead to a lot of frustration on the part of parents, right? When you're trying so hard to get something into your child's mouth or try to administer like a drop or something of that sort, it can get really frustrating. A lot of times, because I've also worked in pharmacy, a lot of parents would come in saying like their child, they've knocked over the bottle of, amoxicillin or, whatever the liquid medication was, and they've now lost half the medication, which gets really frustrating. And other times, the child will even spit out, what was on the spoon or in the alligator spoon, and then the parent has no idea how much their child has been given. So a lot of this turns into frustrations and not knowing, what dosage your child's able to get. Right, so this can lead to poor treatment outcomes if they are missing a dose or not getting the full amount that they're supposed to be getting. And then there's also when we're trying to do something on a regular daily basis, we're having to turn this into a new habit, right? And that has to be incorporated into the busy schedules of families. So whether it be, changing care providers if your child goes to a daycare or to a family member's house for childcare, whether you're just, having to take a trip somewhere or doing activities, going different places around the city, all of those have to be incorporated as well when we're thinking about different ways to get our kids to eat things and take supplements. So the most important factors that have been identified for supplementing children, and we're going to start with supplementation first, and then I'm going to go into more nutrition. But for supplements, number one is taste. We know that kids prefer flavors like sweet and salty, and they're not as receptive to bitter flavors. Also the experience of how the supplement or medication is administered can have a really big impact on the child. So if they're struggling and really fighting you the first time around, if they see you come around with that spoon again, they're more likely to fight you on that. So the idea is we want to make this a positive experience as much as possible. And when it comes to nutrition, this relates to the relationship that we actually create with food. So we don't want to create, a bad relationship with food, right? We don't want children to think that they have to, for example, finish everything on their plate, or they're a bad child, because that can also create unhealthy eating habits as they grow older, thinking that they have to consume everything that's on their plate, or they're a bad kid if they don't eat something. So we have to really be careful about how we frame that type of interaction. So techniques that might help to improve compliance include using, positive reinforcement. Depending on how old the child is, you can try to persuade and reason with them, and involving them in the process. Now, again, depending on the age of the child, you can turn it into, a game or a story, and we'll talk about that as well. But the idea is we want to keep this a really positive experience and not let it be a fight or a struggle every time. Okay, so open strategies. So there are open strategies and closed strategies. An open strategy is one where the kid knows that they're being given something, right? A closed strategy would be you're hiding it in something and you're not telling them about it, so they have no idea. So the open strategies tend to be more positive in nature, and they tend to be more effective for the majority of kids. Again, this isn't going to work for every kid, but it does work in more cases than often not. So one is we have to, change the taste, the smell, or the appearance of a supplement or a medication. So in certain circumstances, you might be able to open a capsule. It really depends on what the supplement or medication is. And, adding them to things like smoothies, yogurts, oatmeals, applesauce. Some parents in one study where they looked at parent forums, parents were even using, things like bananas and Nutella, something to really hide it in, so that you can't really tell the taste. This also works for, for kids who can't quite swallow capsules yet. Again, I must say though, it really depends on what you're giving. And we also have to keep in mind that when you open a capsule and you mix it into something, you now have all those little particles within that medium. So for example, let's say it's with applesauce, right? The kid has to eat all of that applesauce now. Otherwise, they might not be getting the right dose. So that has to be something that we keep in mind. And you also want to keep in mind the distribution throughout that medium as well. So, when we're mixing it in, mixing it in really, really well so that you're not getting all of the particulate matter in one area of the bowl and completely missing it in another area. So just a couple things to keep in mind when we're opening up capsules. Hiding protein powder is a really good one in baked goods. So in our house, we actually use a whey isolate protein powder, and I'll throw it into pancake mixes, into muffin mixes, kind of whatever we're using as like a baking substance, or as a flour mix. I'll mix some protein powder right into that just to increase the protein amount. As well, in the study that they were looking at parent forums, some parents actually used ice cream or something cold like an ice cube to actually numb the taste buds on the kid's tongue, and then administered the supplement or medication. And then in these certain circumstances, parents would actually then use that little bit of ice cream, like a spoonful of ice cream, as a reward for having taken the supplement or medication. Okay. So involving your child in the process. So this really comes down to both nutrition and supplements, right? Using play or involving them, it'll take a lot more, patience and perseverance sometimes. You're gonna have to get a little bit creative as a parent. So for example, maybe you want to designate a special spoon in your house just for medication or supplement use. Back in the day, I think pharmacies still have these, but the alligator spoons, they used to be in the shape of alligators, and you used to give penicillin or amoxicillin through it. So something that's maybe fun for the kid. You can also put this special teaspoon somewhere where they can reach. So when it's time to administer a supplement or medication, you can ask them like, hey, go get your special teaspoon or your special alligator spoon. We're going to fill it up, and you're going to take your magic potion. So kind of having them be a part of that. You can also get them to mix things together for you. So in the case of, like, say, a protein shake or smoothie, we use shaker cups in our house. So you can add the liquid yourself, so you don't have to worry about them spilling. You can get them to add the powder, or you can do it yourself, and then close up the lid and get them to shake it up really well. And you can turn it into make it a song that they can sing while they're shaking it to make sure it's blended really, really well. And that can be how they take part in this. And then turning it into a game. Like I said, I like using the word magic potions. In our house, we do a lot of tincture. We use tinctures as well. And things like fish oils, so a lot of liquids. So we call them magic potions, or turn it into a story for them. So maybe their favorite stuffed animal is sick, and they're going to be the vet that has to give them their medicine. So give the stuffed animal the animal medicine first, and then your kid's got to take their medicine. So turning it into a little bit of a game that way. And again, this takes, like I said, more patience, more creativity, but they're also really good open strategies for including your kid and making it a more positive interaction. Now, the other thing you can do is, if your kid is really focused on an activity or a toy or a game, and you kind of just want to get in and out because they're preoccupied, and you want to maybe use this as a way of having them be distracted while administering something, then wait till they're nice and preoccupied with that activity, sneak in, administer the drop or the tablet, or pass it, give them that little maybe it's a like a gummy vitamin, and you want to give that to them really quickly, get them back to their activity so they hardly notice what had just conspired, basically. Okay, so forms of administration. So supplements can come in very many different forms for kids, right? One of the most common ones we see are oral drops, which are pretty easy to administer because the volume is so low, right? So for example, vitamin D drops are really common for kids, right? So there are a couple different ways you can do this. You can literally put the drop on their hand and get them to lick it off. You can put it again on a spoon or a special spoon and have them, eat the spoon or lick the spoon off. You can add a little bit of a nut or seed butter or yogurt, or again that applesauce. Put that on a spoon with the drop of D drop on there, and have them, take the spoonful, and that way they're getting the entire drop, the whole dose, and it tastes a little bit better for them, and they get a little bit of a treat with it. Right? Or the other option is on a piece of toast, right? Take a little piece of toast. I'd cut it into a really small portion, especially if you're only doing one drop. Put that drop on the toast and get them to just take a bite right where you put that drop. And then you'll know again that they've gotten the whole dose. And because drops are so small, the volume is so small, we don't really have to worry too much about taste. For tinctures and syrups, again, you can do the same thing off a spoon or out of a medicine cup. You can have them chase it down with some juice, a little bit of watered down juice or a smoothie that you're gonna make. And like we said earlier, you can also pretend that it's like a special magic potion they've got to take. With powders, like we mentioned, using shaker cups, let them mix it up for you. Now, this will only work for certain powders. Some powders have a little bit of fizziness to them or carbonation. So some vitamin C powders, magnesium powders will have that. So be careful shaking those ones up because they will foam and they may cause increased pressure in a shaker cup. So for those ones, you might just want to, get a big, like a wooden spoon and have them stir it, have them stir it maybe over a sink where they can't spill, but they're still being involved in the process of making that supplement. Probiotic powders I find are much simpler because they're not made fizzy. So again, that could be something that they do in a shaker cup or just stirring it up. In our house, because my little one is still very young and bottle feeding, I just add a probiotic powder right to her formula in her bottle, and she'll drink it down and not even know that it's there. Okay, so nutrition. There's a little bit more to nutrition because the process of preparing food is a bit more complex than it is just, administering a supplement. So many children go through different kind of eating phases, right? There are certain ages that children may be more picky, or just depending on the child. Some children are just pickier eaters than others for longer. So it's about more or less trying to pin down what will your kid eat. If there's only like maybe one or two healthy foods, like maybe zone in on those. And for other foods, maybe we try to mix them in or hide them into their favorite foods. Again, as before, we're going to try to involve them in the process in preparing foods. Again, this is going to take more time and patience. You might not want to do this every meal time because you might just want to pull your hair out and you're going to lose your mind. Or you might have a very patient child who is very interested in food and will allow you to do this with every meal prep. So again, know your kid. You know your kid better than anyone, right? So pick your moments. So for example, when you're going grocery shopping, you can point out oranges and say, hey, oranges have vitamin C in them. Vitamin C is good for your immune system. It helps us to not get sick. Maybe when you're going past the protein aisle or the animal food aisle, pointing out animal meats, eggs, cans of chickpeas and lentils and being like, these are great sources of protein. Protein helps us to build muscle and be really, really strong, and it helps us to grow. So kind of giving them little tidbits about why foods are important gives them a little bit of context as well. So when you're grocery shopping, let kids help you pick your produce items. Teach them how to identify different types of characteristics of ripe items. For example, right now is a great time because it's kind of melon season right now, but you can grab, there's little mini watermelons out there. You can get your kid to, knock on it and listen for that hollow sound. And you can also smell them. Cantaloupes are a good one for this too, where, if you put your nose up to a cantaloupe, if you smell that sweetness, it's ripe. So you can ask your kids to hey, smell this one. What does that one smell like? Does this one smell ripe? And involve them in picking your produce at the grocery store. Looking at the color of strawberries, are they mostly all red? Are there any that have, still a lot of white on them or green, or, which ones aren't ripe, which ones are ripe? Avocados are great too, because you can actually let them hold it and give it a little squeeze, right? And if you've ever held a really unripe and a ripe avocado, we know that there's that difference in firmness, and you can teach your kids about that too. And the other one I love is pineapple, because that's a lot of fun too, is when you have a ripe pineapple, if you pluck one of the leaves from the top, if it comes out really easy, almost like it falls out, that's a good sign of ripeness too. So you can ask your kid, hey, let's try to pick a leaf, is it going to pull out or not? And then you'll know if it's ripe. And you don't have to just save this for the grocery store. You can do your own grocery shopping, bring these things home, put them on the counter in your kitchen, and then, every day have your kid, maybe the two of you go and you check the ripeness of your produce and check to see, when is it time to cut it open. And it can be like this really neat thing that you do together, waiting for the pineapple to ripen. And then, once you know it's ripe, you get to cut into it and enjoy it. And it's this really kind of nice, positive experience for them. The other thing I like doing is going through the grocery store and like pointing out things without, and this works great for kids who can't read because then they can't look at the signage, and ask them if they can identify something. So pointing at, broccoli and being like, hey, do you know what this is? And just trying to quiz them as far as, can they identify different types of, fruits and vegetables? And if there's something that you've never tried before or they don't know what it is, that might be a really neat opportunity to bring that home, cook it up, and experiment with different flavors and see what it tastes like and how to cook it. So you can really turn this into a bit of a cooking adventure, so to speak. Okay, having your kid help with food or meal prep. So again, it really depends on the age of your kid. If you can give them a little bit, this works a little bit better with older kids where you can have them standing on an appropriate stool, and there's different stools out there depending on the age of your kid. There's actually some that have little almost like railing, like a rail around them, so your kid is not going to fall off a stool and they can actually have something to brace onto if they need to hold on to something. Those work really well for helping kids see to the top of the countertop. If your kid's a lot older, even using just a Rubbermaid stool and having making sure you're doing full supervision, they can see over the countertop. And give them an apron, have it be something fun that you guys do together, protect your clothing, wear something fun, get them to help, wash produce items. They can rinse things really easily for you, get a colander, throw a can of chickpeas in there and just get them to rinse the chickpeas off. Salad spinners are also a really great tool because, they're pretty big and sturdy. You just need your kid to push the button basically, or you push the button and they push the brake button, something really easy to do. Same thing on blenders. Again, make sure your kid is under full supervision, but you can get them to push an on off button really easily while you're holding the machine, right? If your kid has very sturdy hands and is a little bit older, you can get them to measure out ingredients, right? Or, transfer ingredients for you. Maybe you've just chopped up some onions and maybe that you want them to move it into a bowl so that you have everything ready to put into a pan, right? And of course, I always recommend, don't have kids do this over the stove. This should all be done on a countertop just for safety. Again, so all these things can sometimes get frustrating for parents because your kid is gonna make a mess at some point, or they're not gonna listen, or they might pour in too much of something. But this is also really important for building confidence in our kids, right? So pick and choose your moments. This doesn't mean you have to follow this process from start to end, starting at the grocery store, ending with a fully cooked meal. Maybe your kid's playing in the other room and you're just starting food prep, so maybe you invite them in just for the cleaning process or just for a mixing process, and then let them go back to playing again, right? So your kid better than anyone, know what their attention span's like, what they're able to do, if they have the patience for helping, or just have them help with just one aspect, and build on that over time. And then third is, especially for the older children, have them be your sous chef, your little partner in the kitchen. So they can add or pour pre-measured ingredients into bowls or pots for you off the stove. You can have them stir or combine. You can give them a wooden spoon, a whisk, even with their bare hands, right? These are also really good teaching opportunities as far as, which foods are safe. So if you're dealing with, say, ground beef, you're making meatballs, then, we want to teach kids about safety with meat, how, we have to keep everything clean, wash our hands, don't touch your mouth after touching any kind of raw meat. Or, I mean, if you're just doing, cookie dough, for example, you can get them to make things into little balls and help them shape different food items for you. And you can also, make up your own little kitchen language. So in our house, we're big, behind people. So if you're walking behind someone in the kitchen, you have to yell behind, so everyone knows where you are and you don't turn around too quick and run into someone. So, watch cooking shows with your kids. There's so many, reality cooking shows that you can stream or even find on YouTube. Watch something, learn a couple, terms, and then, use those terms now in the kitchen with your own kids. And the most fun part, letting them taste everything, right? So having, a little tasting spoon ready to go, letting them taste sauces or soups or, whatever you're making along the way so that they understand how flavors can change as we cook things. And then the last part is enjoying that meal, right? So we want to give kids a good appreciation for, the food that we're creating and serving. And even if your kid has not taken part in that nutrition process, trying to, have a meal together as a family, right? Sitting all down together, eating slowly, chewing our food, right? Chewing is really important, cleaning up as a family. And again, this doesn't mean that every night you're going to have a family night and your kid or your toddler is going to sit for you, for that amount of time every night. It's not going to happen, and that's okay. Again, you pick your moments, you try your best. But then kids they see things over and over again, and they learn what to expect, right? They learn what dinner time means, and the foods that we put together, and now they have a little bit more appreciation for nutrition. So again, you're going to pick and choose your moments. If we can put them all together, then great. But otherwise, those are, ways that we can incorporate involving children in nutrition. Okay, so this is a really short presentation today. Again, my references today were from two different papers. One was the study that was surveying parents as far as what worked well for them, and the other one was regarding pediatric drug formulations. So what we are now trying to do with certain medications to get children to take meds more easier, and the things that we're identifying. So one of the new kind of administrations of medications is actually becoming very small, quick dissolving candies or powders, basically. So something they can put into their mouth, dissolves quickly. We don't have to worry about it. It tastes like candy almost, and it goes through their system. AOR has, as an example of that, AOR has created their lava rocks, which is very similar to the formulation that this paper was kind of discussing in that administrative form. So they're really great because, you have something that's really good tasting, it dissolves quick, and you know that the kid's getting the full dose of that. Yeah, so that's it for me today. I'd love to hear if anyone has any questions, and we'll go through those.
Thank you so much. That was great. I even learned quite a few things in terms of the making sure fruit is ripe. But I think that's such a great activity. So we have a few questions coming in, but I just wanted to start us off. When we're speaking about kids who are getting a little bit older, we're seeing more and more frequently kind of disordered eating is starting to pop up, especially in young girls. How do you kind of manage, and I know this could possibly be a whole other conversation, but how do you manage supplementation management and being aware of nutrition with that hyper awareness?
So I see this more with nutrition and meals than with supplementation, right? So with food and meals, again, it's about creating a positive experience with the food itself. So for example, not force feeding your child, a meal. The idea is that, we want to serve portions to ourselves that we think that, we can consume. And if your child accidentally, or if you put too much on your child's plate, we don't want to think that they have to finish everything, right? Because then they might, grow up with that mentality and may start overeating as well. For kind of younger preteen girls, or even girls as young as 8 to 10 years old, it's about starting to make sure we're understanding our own habits with food. So for example, not using food as an emotional crutch, right? And it's okay, you have a bad day, maybe you want to bake a little bit, bake a small batch of cookies or have a little treat, but we want to avoid having that be the standard. When you're feeling low, depressed, you have a bad day, you always go for, the sugary bad foods. It's breaking those habits. Because I have seen quite a bit now women who, as they grow older, that becomes their crutch. And now every time, something stressful happens or something upsetting, we're reaching for those foods. And a lot of girls now, because these foods are also kind of pretty addictive, especially sugars. So we start to overconsume them until, like, you go for one cookie and then the whole bag of Oreos is gone. So it's about avoiding those trends, especially.
Mhm. Yeah, and that's a great point. I also think, as we start to discuss healthy body image, that does also go hand in hand with conscious, mindful nutrition. So yeah,
Yeah.
that's a really good one.
And also not vilifying foods. That's another really big one that I'm starting to see more of is parents who say like sugar's bad for you. You can't have any sugar because like all sugar is really bad for you, and that's not necessarily the case. We want to teach kids that sugar's not necessarily bad, but too much of sugar could be bad for your system, and here's why. You don't want them to feel guilty, for going to a birthday party and having, one piece of cake, or, having a treat at at a friend's party or at a sleepover. The idea is not to vilify foods, but to use these as educational talking points. So, a little bit of sugar is okay as a treat, or as, for a special occasion. These things are fun to have and fun to make, but these aren't the foods that can sustain our bodies, right? We have bacteria that can thrive off of these, and they're bacteria that aren't very helpful for us. They can actually create a lot of health problems and make you gassy and bloated, and give you tummy aches and things like that. Maybe they make you really grumpy. They stop you from sleeping really well. So I think there's a good educational discussion here that can happen.
Okay, great. So our next question is kind of centered around what you think are some of the best powders, like specifically for kids to add.
So sorry, can you
Yeah,
explain that?
I think what they're asking is, what are the best types of powders? So is it the more the magnesiums or the,
So
or if you have
it's
any
not just that
specific?
there's like the best powders, it's really what you're trying to achieve. So, so for example, if you're trying to get your kid to take more vitamin C because they're going back to school and you want their immune system up and they could really use some extra vitamin C, maybe your doctor told you to give your kid more vitamin C. You have a couple options there, right? You do have, chewable tablets, which work just fine. But if your kid doesn't really like the taste or like that sourness of a chewable, maybe they'd rather drink it, or they're not getting enough water, so you want them to drink, more fluid and get their vitamin C in that way. Powdered vitamin C's are nice for that. Just again, depending on the age of your kid, you have to be very careful as far as the dose, because most powdered vitamin C's are about 1,000 milligrams per powdered package. So just being careful about that. But that's one really good way. If your kid needs magnesium, then yes, there are lots of powders that you can use instead of having them take a horse-sized capsule, right? It really depends on what you're looking to supplement for. So there's not powders for everything. I do like using powdered probiotics or chewable probiotics in kids because I find those to be really easy to mix or for them to take. So
Okay.
probiotics might be a really good example of that.
We actually did get a clarification. So I think they're talking about the tastiest powder. So, and this brings up an interesting point of, how do we make sure that they're delicious, but not compromising on, sweetness or some of the concerns with dental health. So what do you suggest people look for in terms of ingredients that will improve flavor, but not necessarily compromise, what we're trying to do? Because you had even mentioned one of the studies gave the supplements
In
in
Nutella?
Nutella, right? Yeah. So how do we kind of, what should we look
Yeah.
for?
So again, it depends on the age of your kid and their taste preferences. Like right now, my little one who's 10 months old just loves plain unsweetened yogurt, right? And a lot of younger babies do tend to really like the taste of yogurt. So for example, in that age group, we're looking at using a high fat, no sugar or low sugar yogurt. And you can hide it really easily in that without having to worry about the sugar content. Now, in this case, though, you wouldn't want to use like an effervescent or a fizzy powder in that type of medium. That would be more for like your probiotic powders, where they're like a tasteless, odorless. There's nothing else in there. It's just like say the probiotic. You could mix that into a little tiny bit of unsweetened yogurt if your kid will take that. That would be a really good option. It's all about label reading too, right? So I prefer if something's going to be sweetened, I'd rather it be sweetened with a little tiny bit of stevia versus sugar. But the only way to know is to like taste it yourself. Does it taste sweet to you? and then managing that taste profile with that afterwards. So even as far as like giving juices to kids, like I always suggest, really water it down. Like pure juice on its own is incredibly sweet and a kid doesn't need that much sugar. So if you water it down, taste it yourself, and then you could try mixing a powder into that blend. And then again, you're controlling the sweetness. Does that make
Hmm.
sense?
Yeah, absolutely. And I think yeah, the monk fruit we're now seeing a
The
lot
monk
more
fruit. Yeah,
alternatives, monk fruit extract and um
exactly.
okay.
Yeah, yeah, same with apple sauces. You want to look for one that's unsweetened. It should just be apple puree and nothing else added to it.
Right. Yeah. Okay. So in terms of strategies for parents who maybe are trying to get the appropriate dose, of course we would always recommend that they see a naturopath or their speak to their doctor about this. But what would you suggest is the lowest age where you can start taking probiotics?
So again, this is not medical advice for everyone. I'll just tell you my own personal experiences. I've been supplementing probiotics in my little one almost since birth. So we started with the BioGaia drops, which are actually typically recommended by some doctors for colic in babies. So that was something I wanted to kind of get ahead of. So there are some probiotics that are fine for use as, in infants, as soon as, just after birth. But again, talk to your doctor or your naturopath and make sure that the one that you're using is safe in that age group. A lot of them will be labeled as, for use in children, 2 years and up. Some probiotics, if they are, even if they're labeled that way, they might be okay for your kid if, your naturopath or medical doctor or whoever your prescribing healthcare practitioner is, if they've told you that's safe for your kid, then you could do that. Right.
Hmm.
So it really depends on who's prescribing, and what you're trying to use.
Yeah, and I know we have a lot of professionals on the call today, and so I'm sure many of them are familiar with kind of changing dosing strategies for children. You know, there are a number of kind of resources in the pediatric world that we always refer to, right?
Exactly.
Yeah. Okay, we have another question in regards to alternatives to for iron in particular. That sometimes tends to be one that, uh, children sometimes don't necessarily like. There is Baron Soul. I think that's a specific brand
Mhm.
someone's
Yes.
asking about. Do you have kind of irons that you prefer? And also, what should people be looking out for in terms of preventing that constipation for their children?
Yeah, so in general, iron supplementation should be recommended by either a naturopath or a medical doctor, right? Because we don't want to overload iron in a child and it can cause constipation. So for infants, what's normally recommended is if they're no longer being formula fed, because formula does contain all the iron that they need, or for babies who are breastfed, where we don't see as much iron in breast milk. A lot of doctors will recommend rice cereals or oatmeals that have been fortified with iron, and these are pretty common. You can find them both by our generic, not generic, but like kind of our standard brands like Gerber and Heinz will make these types of cereals, but also a lot of new kind of health food brands are also doing this now as well. There's one I think called Healthy Times, I want to say, which is just like a plain oat flour that's been fortified with a couple B vitamins and iron. So, giving those types of oatmeals and cereals can be one way if you're looking, if your kid's not, if your kid's older even, and if they're not a big, meat eater. So using kind of fortified cereals would be one option. There is another liquid iron that I just can't remember the name of. It's by a German company. It's like this really tall, wide box. It's a liquid as well, and I've heard a lot of kids have been able to take that one fairly well. The dose is pretty low though, so I always just say, talk to whoever your prescriber is and make sure you're getting the right dose, because it is fairly low. But I find that one I've heard is pretty tolerable. I wish I could remember the name of it, but I can't. But yeah, it's a German company.
Okay.
Yeah.
Floridex, someone is saying?
Oh, Florida. Yeah, I think that's the one.
Yeah.
Yeah, that one's really popular, because I find with that one you get less of that metallic-y taste, where some of the even the iron liquid formulas that I found for adults taste really metallic-y and are just not very enjoyable to take. So, always, I mean, you can always taste something yourself as a parent just to get an idea of what your kid's experiencing, and you can modify flavors at that point if you need to.
hmm And actually, you brought up a really interesting point, and maybe you could speak a little bit more to um, with breastfeeding mothers and
Mhm.
nutrition around that. Do you have any quick tips and insights that you always recommend in your practice?
Yeah, so there's a couple things that we've seen. So one is, making sure you're hydrated, right? You're creating fluid for, as substance for another human being. We need to stay hydrated, right? So getting enough water intake is really big for breastfeeding mothers. Getting a good, just balanced diet. And I guess two big things that I see with breastfeeding. One is if your kid starts reacting to something, so for example, if they start getting kind of allergic reactions, eczema, any kind of rashes, or maybe their bowels, they start getting more gassy, start to evaluate your own diet. Because we're finding that like antigens that can cause these reactions in kids can even show up in breast milk. So, for example, again, this isn't every case, but just because it's an easy case to talk about. So, if your kid's getting really, gassy and has rashy patches or eczema, consider maybe doing a dairy elimination, right? Getting rid of dairy for, a couple weeks, see if the rashes clear up, if the colic clears up, and if it does, that's the answer. It's not always dairy. It could be anything, right? It could be onions and garlic. It could be wheat. It could be, anything. So sometimes it's just about investigating something that you're eating could actually be impacting your child and what they're experiencing digestive wise and immune system wise. And the other thing, there was a study that I was looking at a couple of years ago that actually showed that your omega fatty acid profile actually translates through breast milk. So, the more balanced your healthy fat intake is, the better it will be for your child. So, for example, if you're taking an omega-3 fatty acid, or if you're eating, a lot of good healthy fish, um, things like sardines, anchovies, salmon, all those healthy fats will translate and actually show up in your breast milk, and that'll get passed on to your child as well. So, your healthy diet translates in breast milk to your child.
Perfect. Okay, just a few more questions.
Mhm.
Um, it looks like one of the doctors is asking, sorry, it's a little bit confused here. Let me just get this. Okay. It seems like the Floridix may be contraindicated in younger kids. Uh,
Mhm.
I'm not too sure. Well, I guess we'll have to look into that, but particularly for um, premature births who really require that supplementation in the first year, it doesn't look like there's too many options.
So
I'm not too familiar with
yeah,
that.
so in those cases, especially with premature babies, they're often given formula. And formula is iron fortified, and there's different levels of formula. So, kind of stage one has a little bit less, and then stage two, they really bump it up because at 6 months old, that's when where our iron intake needs increase a lot more. So for preemies, I mean, go by what your medical doctor is suggesting as far as supplementation for younger infants. Not all infants under the age of 6 actually need an iron supplement. It really depends on that child. They'll often do blood work at that age as well, just to see if they are at risk for anemias. But then I would go with their recommendation as far as how to supplement iron, and it's usually a formula, not something like Floridix.
Okay.
Hmm.
Okay, perfect. So I think we have, okay. So I think those are all the questions we have time for right now. Thank you so much, and I really appreciate you being able to speak to us. This is such an exciting topic, and I think there's still obviously so much more to learn about it. We are going to be having another presentation coming up October 6th, and I will be discussing unraveling the insomnia puzzle, what you need to optimize your sleep. If you're not already registered, you can sign up at aor.ca/webinars with an S /B, the letter 2 and the letter B, so B2B. Thank you so much for joining us today. If you do have additional questions in regards to this presentation that maybe we missed, some of them weren't coming in through all the way, you can email us at marketing@aor.ca. That's marketing@aor.ca. Thank you all so much. Have a wonderful and healthy day, and we hope to see you again. Thanks, Dr. Sedek.
Thank you.